Good morning, afternoon, evening, depending on where you're joining us from, anywhere around Africa and the world. My name is Lebogang Tisani Masera, the founder of African Female Voices. I will be hosting today's episode of the Amplified Voices Corner, where we celebrate African women and the strides that they're gearing towards in the rest of the world. I am joined by the incomparable Dr. Isatou. I will take you through her bio so that you know more about her. As I said, our aim here is to not only celebrate African women, but shine a light and spotlight important issues that are affecting and challenging African women across the diaspora. And we want to be able to dig deep into what can we do to be allies to support causes. I'm going to read you Dr. Isatou's bio. It's quite extensive, but I hope I can do justice to it. So this brilliant woman is a political activist, or rather a politician, who has done extensive work in the Gambia region. She has been a noted campaigner against female genital mutilation, which is one of the topics that we'll be discussing in today's episode. And she also became the first female Gambian president candidate in 2016 before dropping out to endorse Adama. She has served in the Barrow's cabinet as trade minister and then as health minister. She became the vice president of the Gambia in 2019 after a major cabinet reshuffle. Today we'll be digging deep into the issue of female genital mutilation, as she's also the co-founder of the Gambia Committee of Traditional Practices, which was founded in 1984, and they have played quite a role in ensuring that through the Women's Amendment Act, there is a criminalization of female genital mutilation. So welcome to today's episode, Dr. Isatou. We're so glad to have you. Despite the glitches that we've had during the past days, it's quite an honor to have someone of your caliber. This is just a casual conversation that we're having in order to inform the public and the African diaspora of the issue of female genital mutilation. I can tell you that in the Southern African region of the world, we are not quite familiar with just the severity of the issue, and which is why we wanted someone like you to shed light on just how the issue affects women, especially in the Gambia. I know that the pink elephant in the room with regards to this is that there were recent news that were trending and spiked quite an uproar with that the Gambia would like to decriminalize female genital mutilation. I mean, we're talking about something that affects almost 200 million women in the entire world, and 44 million of those is African women. How have you seen this issue in your experience and just your exposure in the Gambia affecting women?
Thank you very much, Lebo, and I'm pleased to be part of this very important podcast, African Female Voices, and to congratulate you for having this type of outlet for African women and other women of the world. I am happy to engage and to say that FGM is gross violation of the sexual and reproductive health rights of women. It is wrongly associated with religion, particularly Islam in my country.
I have a question. I want to dive deep into the current issue to say that there are talks now. There was a bill that was proposed to say that they want to decriminalize it. I mean, the data speaks for itself to say that since the Women's Act that was enacted in 2015, there's been a decrease. I was a survey by the Gambia Demographic and Health Department, which just shows that there has been a slight decrease in female genital mutilation. So it's decreased. It's now 73% of girls between 15 and 49 who've survived it as compared to 75%.
One thing that you have to understand, it is because of the effective implementation of the law that was put in place in 2015 and finally came to be effectively implemented in 2023 that resulted in all these sort of efforts by some religious leaders and few National Assembly members, flowing it from a very political context, because many laws are in place that were effectively implemented. They imprison people, they sentence people, they fine them, and it didn't raise any issue. Why is it that with a law that is in place to protect the girls from this barbaric act, an act that affects their bodily integrity and dignity, to protect 8 children, the religious leaders and some National Assembly members are coming back? Obviously, the answer is either resistance to change or hatred for women. That's misogyny. Now that we are aware of that, and since this was done, we went to court. We are doing a lot of mobilization. A lot of organizations are joining GAMCOTRAP, the international community, and including even the efforts we are doing to make visibility of this issue, to talk about it. The issue was put into the House for first reading, second reading, and then pushed to the Select Committee on Health and Gender to look at it. And we have gone through a lot of processes as I am speaking now. We have presented position papers, which I can share with you after this interview, and then we try to raise awareness. I think the awareness among the National Assembly members is very important. But what I found very hypocritical is that some of the members who are there were part of GAMCOTRAP movement. They have been engaged in training even some of the women at community level. These are the men who have used the opportunity to get themselves to the National Assembly. And here it is today, when it comes to the issue of women's rights or protecting the young girls, they are standing on the outside of the coin, which is very, very dangerous. So we are very patient because they are there as lawmakers. But I expect that with the engagement that is being done right now across the country and all over the world, this was done the law was passed during a heightened authoritarian regime of Yahya Jammeh, when impunity, abuse, and everything was going on. But he agreed with the thing after they were well sensitized and put the law in place. So under a democracy like the Gambia right now, I expect that the law should remain because the law is law and it's about protection of human rights. It is about the responsibility of the state to ensure that the laws that are put in place are used effectively to protect the rights of women and girls. And when we talk about democracy, it's about progress. It's about also taking responsible decisions to protect those that are vulnerable or put in harm's way. And this is what FGM is doing. So we are ready right now. As I'm talking, we have secured funds from Wallace Global Funds, who is giving us opportunity to do consultations. Donor Direct is also working with us, Equality Now. So we are now going into, as I'm talking to you, after this meeting, I am getting set to go into the field with my team, to reaching out to the 58 district chiefs who have also been supporting GAMCOTRAP and the law. They said the law should not be repealed because it was through their effective engagement at their district level that the law was put in place, working with their communities. We were only empowering them with the information and allowing them to engage in conversations that were culturally relevant, using culturally relevant approaches until they all came to consensus and agreed that the law has to be in place. We will continue to do so. So the consultations now is for the people themselves to be told they are aware of the fact, and I'm happy the response I'm getting from the communities is that let them repeal this law, they will repeal their seats. It's political now. It's getting to a very political level. And I think it is lack of commitment to women's rights and progress. That is why this is happening. But in a system where you have democracy and where there is a law put in place, which is the responsibility of the state to ensure that that law is respected, that law is put into perspective, this would not have reached here. But now that it is there, and in the name of democracy, still democracy, we will continue to engage constructively and follow the rule of law. But if this thing happens to be repealed, we have our plan B. The state should be accountable to the people, and it can be called to accountability through the legal system, which can be used to protect the rights of the innocent girl child who is never participating in the decision-making process and sometimes does not even know. They don't know when it is going to happen. Like all of us who have been victims and now surviving, we were blindfolded and a lot of things were done to us. So these are some of the things, and it's so sad. The Gambia has very good reputation in passing all the laws and conventions and protocols that protect the women and girls in the Gambia. I can attest to that as the former vice president. I have been very active even before I came into governance through this democratic process, that I was very, very much active working with the Human Rights Commission and also internationally, nationally, helping the Gambia to move forward with these laws, and they are all in place and intact. So the legal environment is very clear, unambiguous there.
Thank you so much, Dr. Isatou. We reach far and wide. I hope our audience can really partner with the work that you do and we are always available as African female voices to shed light on this issue. I mean, just 2 weeks ago, we were interviewing Aya Chebi from Tunisia, where we shed light on female genital mutilation. We want to run a social media campaign and ensure that we reach people, even the young people on social media, to understand the practice, understand their rights, understand that there is no religious basis for this inhumane act. So thank you so much for joining us today, and we look forward to partnering with you in whatever ways we can as African female voices to ensure that this law is upheld, the woman is protected, and the woman is included in these conversations. Thank you so much.